As we approach the end of the module, I want to spend some time looking at some of the less obvious, or at least less discussed, aspects of our role as clinical educators. And this involves looking at the hidden curriculum. I have included some resources which describe the concept, but to put it simply, hidden curriculum refers to the unspoken or the implied messages that we give students through our own behaviour with them, with our colleagues, with our patients, and so on. And this really encompasses everything that we've been doing this whole semester. While teaching the students all of the individual components of the course, or the formal curriculum, if you like, both in clinical skills and a clinical setting, there has been this undercurrent running through all of this of how students perceive us as teachers in our professional role. I suppose it's really about role modelling. It's about not only the skills we have clinically, but also how we approach things. So our personalities, our professionalism, how we behave with our patients, even just simple things like our tone of voice. Are we sympathetic? Are we empathetic, both to our students and our patients? And do we teach our students in a different way to the way we treat our patients? Students ideally should want to emulate the way we behave as much as the skills clinically that we have, and that's really what the hidden curriculum is about. To give you an example of something that recently happened to me, one of my second year students, so that's kind of middle of their course, was treating quite a young child who had a lot of dental decay, and he was there with his father. And throughout the appointment, the father seemed to pay not very much attention to the child in the chair, and that clearly annoyed the student. When I walked into the surgery, what I saw was a father who was obviously exhausted. He had a younger child with him who was very energetic that he was trying to entertain, and he was obviously desperately trying to sort something out on his phone as well. So whilst the student continued with their appointment, I found another member of staff to help look after the wee one. And I said to Dad, there was an empty room next door, and did he want to go in there if he had like a phone call to make or whatever? So we then carried on with the child's appointment, and in the debriefing, the student commented on how they hadn't seen a tired, stressed parent until the interaction that I had with that parent. They thought they were just dealing with a father who didn't really care about his kid. But seeing me speak to him had totally changed their perception, not only of that parent, but potentially of other parents that they'll come across in the future. Now, that was by no means a deliberate teaching tool on my part. I was simply acting on my professional and to some extent personal life experience. But it was a really powerful experience for the student. Whilst you might not have recognised it, you've likely been looking at other teachers, educators, in the way that they do their job and been emulating it yourself because you think they do it really well and you want to aspire to that. And in that way, you yourself have been influenced by this hidden curriculum concept. I'm quite sure that that person you've been trying to emulate had no idea that they were even having behaviour worth emulating, and potentially nor did you have any idea that that's what you wanted to get from them. So hidden curriculum is a really interesting concept. You need to be aware that your students are watching you all the time. They watch how we behave. They watch how we behave with the people we work with our patients, that type of thing. They look at our skills and they want to do that, but more so, we want them to want to be as professional as we are. I've also given you some resources this week on graduate attributes for kind of some extra reading. It's a slightly different concept to the hidden curriculum, but along the same theme, hence why I've included it in this week.